The next talk will deal with the issue of cancer in Fukushima. Now, to tackle this very big issue, what we did is a structured literature analysis in December of 2020, where we searched PubMed and ResearchGate for the following keywords. We eliminated all irrelevant papers, for example, the papers where author's name were Fukushima, but they dealt with a completely different subject. And in the end, we came upon 57 papers relating to thyroid cancer after the Fukushima nuclear disaster, 12 papers dealing with the topic of leukemia, and 8 papers dealing with solid tumors. Now, this might look promising at first, but 28 of the thyroid papers were published by the Fukushima Medical University and or the International Atomic Energy Agency, and 18 of these by one person, Shinichi Yamashita, who we will come to later. Also, 2 were published by the nuclear industry, and only 8 were considered relevant studies in the sense that they were scientifically sound and neutral. Regarding the papers on leukemia, we found that only 3 addressed relevant problems, whereas 7 were just basically generally discussing future fields of research or policy, and 2 were published to negate possible risk of leukemia. And regarding the papers on solid tumors, 3 attempted to calculate the global incidence, and 5 addressed side aspects such as possible technical solutions for finding solid tumors. So in the end, the number of papers that were actually useful to us as researchers was very little, and most of them were dealing with thyroid cancer. This is also the reason why the main subject of my talk today will be thyroid cancer, but I will come to other types of cancerous diseases later in my talk. Now, as we said before we come to the health implications, we first must look at the source term, the amount of radioactive emissions. And in the case of thyroid cancer, we will take a particularly close look at radioactive iodine, most notably iodine 131. Now, you see here the photos of the explosions in the nuclear reactors, and you can imagine that in these nuclear plumes, there are a lot of particles of radioactive iodine that are distributed over the countryside. We now know that the source term, the total amount of radioactive iodine 131 released during the meltdowns in Fukushima in March of 2011 is somewhere close to 150 to 160 petabecquerel. Compared to the source term in Chernobyl, this amounts to roughly 8.5 to 9% of the radioactive iodine released in Chernobyl. On the left-hand side of this slide, you can see a relatively new map showing the deposition of radioactive iodine 131 over the countryside around the nuclear power plant. And on the right-hand side, you can see a group of people standing in line in these first days of the nuclear catastrophe in March of 2011, waiting for information concerning evacuation. Now, you have to imagine that this radioactive iodine 131 is sort of like a particle of dust. The explosion catapults it into the air, where it's spread out by wind, and then it collects in clouds and comes down as nuclear fallout. In the case of Fukushima, it was mostly nuclear snow, but also nuclear rain. And these people standing here, they are left relatively unprotected. Now, we know, or we've known for a long time, that there is a way to prevent the uptake of radioactive iodine. And that is if you distribute stable iodine, a medication that is taken in the form of a pill, in the hours before the expected nuclear fallout takes place. We know today that the stable iodine that is stored in Japan for cases of nuclear catastrophes was never actually handed out to the general public. We know that there was a very conscious decision not to do this. The Japanese parliament had a Fukushima nuclear accident investigation commission, which found in July of 2012 that although the positive effects of administering stable iodine and the proper timing were fully known, the government's nuclear emergency response headquarters and the prefectural government failed to give proper instructions to the public. So what happens with radioactive iodine is displayed here in this graphic. You can see these particles spread out over the area through wind and coming down on the grass through precipitation. You see cows and other animals eating the contaminated grass. The radioactive iodine then goes into the cow's milk, and people can be exposed to it by drinking the milk. And radioactive iodine acts a lot like normal iodine in that it is collected in the thyroid, where it is used in the production of thyroid hormone. But it also travels through the bloodstream and can enter the unborn child in pregnant women. And what happens with radioactive iodine is what happens with all radioactive pollutants that enter the body. They can destroy or mutate DNA and cause cancerous lesions, thereby leading to what we see here in this graphic, a thyroid cancer. The radioactive iodine fallout in Japan was fairly severe. We know from the IAEA that nearly all vegetable and milk samples in Fukushima and also in Ibaraki prefecture, and drinking water samples in Fukushima, but also in neighboring prefectures like Ibaraki, Tochigi, Gunma, Chiba, Saitama, and even in the northern districts of Tokyo, exceeded the safety limits of radioactive iodine in the week of March 17th. We also know from the Japanese Ministry of Science and Technology, MEXT, that contaminated vegetables were found across the Honshu Island with iodine-131 concentrations of up to 2.5 million becquerel per kilogram. Even 1 month after the nuclear meltdowns, there were still vegetable samples with iodine-131 concentrations of above 100,000 becquerels per kilo in some regions. In Ibaraki prefecture, spinach, mustard, parsley, mushrooms, lettuce, tomatoes, onions, strawberries, wheat, and barley were found to be contaminated with radioactive iodine with levels up to 54,100 becquerel per kilogram. And in the picture, you can see a Japanese farmer dumping radioactively contaminated milk into the soil. Now, we know that iodine-131 has a very short half-life of just 8 days. So you can see here in this graphic that the dose rate in microgray per hour decreases rapidly over the course of 80 days, reaching almost zero after 80 days. But the Japanese Ministry of Science and Technology, MEXT, actually found soil samples more than 90 days after the beginning of the nuclear catastrophe in June of 2011, with iodine-131 levels exceeding 1,300 becquerel per kilogram in 2 villages, Nami and Itate. And also the WHO found vegetable samples in June with iodine-131 levels of up to 2,200 becquerel per kilogram. So was this a case of continued emissions from the crippled nuclear reactors, or just extremely high initial doses? We will probably never know, and these controversial issues are also not discussed by WHO or the Japanese government. Now, if you look at the numbers concerning the estimation of the health effects that this radioactive contamination will cause in Japan, there is a wide range of numbers. Let's look at the most conservative. The United Nations Scientific Committee on the Effects of Atomic Radiation, run by countries with nuclear energy programs, with a very high interest not to harm the nuclear industry, came to the conclusion that infants would have a thyroid dose in the first year after the nuclear catastrophe of between 15 and 83 milligray in Fukushima prefecture, and between 2.6 and 15 milligray in the rest of Japan, depending on which area they live. Now, to put this in perspective, the normal thyroid dose of an infant in Japan would be 1 milligray per year. So we can see there's a big difference. Unscare calculated a collective lifetime thyroid dose for all of Japan of around 112,000 person gray. If you take the coefficients of the BEAR-7 report, which deals with the health implications, the biological effects of low-dose ionizing radiation, they come to a conclusion that you can calculate about 0.009 additional cases of cancer per person gray. You come to around 1,000 excess cases of thyroid cancer in Japan due to the amount of radioactive iodine released. Now, because unscare's numbers and estimations are very conservative, to put it mildly, these 1,000 cases are most likely a vast underrepresentation of the actual amount of thyroid cases that would be expected in Japan due to radioactive iodine emissions. It's important to look at these estimations, though, because it is very difficult in real life to actually detect rises in incidence of cancer cases in a given population. And this is because these epidemiological studies are very difficult to perform. This could be one of the reasons why in Japan there are basically no epidemiological lifetime or longitudinal studies examining the health effects of radioactivity in Fukushima, except one: the Fukushima Medical University's thyroid ultrasound examinations. They are part of the Fukushima Health Management Survey. They've been going on since 2011. They are the largest thyroid screening in history in children. It started with a study population of around 300,000 children, and it's been running for almost 9 years now. The latest publication of their findings were published in January of 2021 at the 40th session of the Oversight Committee, and this is data that runs all the way up to June of 2020. The thyroid ultrasound examination can be divided into screening rounds. There was a preliminary baseline screening that took place from April of 2011 to March of 2014. And ever since then, there have been another screening every 2 years. So the second screening, 2014 to 2016, and so on. And we are now in the middle of the fifth screening, although there's very, very little data from the fifth screening available as of yet. We are basically just collecting the data of the fourth screening, which ran until March of 2020. Also, the Fukushima Medical University began excluding children or adolescents who have reached the age of 25 years and put them in a separate study, which is called the Age 25 Milestone Study. Now, this has caused a lot of confusion, and it's also led to a sharp drop in participation. Participation in the Age 25 Milestone Study is below 10%. So most of the adolescents that reach age 25 are not examined anymore. Now, before I talk about the results of the thyroid ultrasound examination in Fukushima, I first want to discuss the 5 major problems that we as IPPNW see with this examination. The first problem is the person responsible for the study, Professor Shinichi Yamashita, who ran the study in the first years and is still very much in control of the examination from behind the scenes. He's the former president of the Japan Thyroid Association, and in the week after the nuclear meltdowns was named Radiation Risk Management Advisor to Fukushima Prefecture. He's always been an ardent defender of the nuclear industry, and in a letter on March 17th, he called on the prefectural and the local governments and authorities not to hand out stable iodine to the population in order to prevent them from being worried. In a speech just a few days later, he told the population of Fukushima that if you are smiling, you will not have any radiation effect. And he told them in the same speech that there will be absolutely no effect on health as long as the environmental pollution level is less than 100 microsievert per hour. To put this in perspective, baseline natural background radiation in Japan is around 0.26 microsievert per hour. Professor Yamashita followed up in an interview with the German magazine Der Spiegel. I do not think that there will be any direct effect of the radiation for the population. The doses are too small. So it's very problematic that someone like Professor Yamashita was actually initiating and running this examination. And this can be seen in all of his publications and all of his statements, that basically he feels that this study's main objective was to calm parents' concerns about radiation and to show that there is no effect on children's health. The second problem is the influence of the nuclear lobby on this examination, on the thyroid ultrasound examinations. In 2012, the International Atomic Energy Agency entered an official cooperation with the Fukushima Medical University, as the contract says, in the area of human health. IAEA, you have to remember, was founded to accelerate and enlarge the contribution of atomic energy and to encourage and assist research on and development and practical application of atomic energy. So we have an organization that is not the nuclear industry, but the largest international nuclear lobby organization, sending money, sending people, sending logistic support to the Fukushima Medical University, a rather small Japanese provincial or prefectural university, in order to perform this largest thyroid examination on children ever. So you have to see that there is a big conflict of interest in this arrangement. The third problem is the monopoly that the Fukushima Medical University has on these thyroid cancer cases. Parent organizations have frequently criticized the very superficial nature of the thyroid examinations, stating that examiners spend just 2 or 3 minutes examining the thyroid of their children. The ultrasound images are normally kept from the families. They are not allowed to make a copy or take them home. And non-FMU physicians who are not working at the Fukushima Medical University were discouraged in letters, publications, from secondary opinions, from examining patients in between screening intervals. So Fukushima Medical University really wants to have the monopoly on these patients and not allow any outside influence. The fourth problem is the study population itself. At the beginning of the study, all inhabitants of Fukushima Prefecture under the age of 18 at the time of the nuclear meltdowns were officially included in the thyroid examination study. This was around 300,000 people. But since then, we've seen a very high rate of people lost to follow-up who dropped out of the study, for example, by moving out of the prefecture or not coming to follow-up examinations. And also, all children or all adolescents after the age of 25 are excluded from the study and put into another age 25 milestone study, which, as I've stated before, has a participation rate of less than 10%. So, in effect, they are not being examined anymore. In addition, Fukushima Medical University is sending representatives to schools, encouraging adolescents to drop out of the study. The argument that adolescents have a right not to know about cysts or nodules or even cases of thyroid cancer that they might have, because Fukushima Medical University until today is arguing that these are not actually health risks, but are the effects of large-scale screenings. And this is why we've seen a gradual decline in the study population over time, as you can see here in this graph. In blue, you see the target population, and you see that in the initial baseline study, there were around 367,000 targeted children in Fukushima Prefecture, of which 300,000 were actually examined. So there was a relatively high percentage of children actually included in the study, of close to 80%. In the second screening, there was a larger number of target population, mainly because the children born in these years were included in the study. But the number of children actually examined declined to a little more over 70%. In the screening episodes that followed, you see the number of children actually being examined decreasing to around 181,000 in the years 2018 to 2020, and that's about 62% of the target population. And what this means is that there are more than 200,000 people in Japan who were children at the time of the nuclear meltdown, who lived in Fukushima Prefecture, who are not being examined, and whose cancers, cysts, and nodules are not being documented. Now, the fifth and last problem is the active exclusion of cases. And this is a very strange concept, and it took me a while to understand it as well. FMU is examining the children every 2 years. But if a screening yields a suspicious result, they recommend more frequent follow-ups, which does make sense from a medical point of view. Only they recommend these follow-ups not within the study, but at Fukushima Medical University Hospital. And if during these follow-up visits, in between 2 screening intervals, thyroid cases are diagnosed, they are not counted in the official study. Until June of 2017, at least 11 children from the study population in Fukushima were diagnosed with thyroid cancer and treated at Fukushima Medical University Hospital. In these cases, although they were children from Fukushima who lived near the nuclear power plant in March of 2011 and were included in the study, their cases are not included in the total. And probably there have been many additional cases since then that were diagnosed at other hospitals and not included in the official study. So now let's come to the findings of thyroid ultrasound examination. I will talk about the cysts and nodules, the incidence of thyroid cancer, the development of precancerous lesions over time, the regional differences in incidences, and the age exposure decreasing over time. Let's start with the cysts and nodules. You can see here in this graphic the baseline screening 1, the second, third, fourth, and fifth screening. And you see that the rate of cysts and nodules found in the study population increases from screening to screening. In total, cysts and nodules were found in more than 160,000 of the examined children. Now, these are not always precancerous lesions. Not every cyst, not every nodule leads to thyroid cancer. This is very clear. And we know that cysts and nodules occur in healthy children who do not develop thyroid cancer as well. But the rise in the detection rate over time is notable, especially if you consider that these are the same scientists, the same doctors with the same machines in the same place, doing examinations in the same population every 2 years. There is a study by Dr. Iwaku from Japan's largest thyroid hospital, the Ito Hospital in Tokyo, and he also examined a pediatric cohort of more than 1,000 children in the same age bracket as in Fukushima between 2005 and 2013. He was not able to show a rise in incidence rate similar to Fukushima. So this does make you wonder why in Fukushima they are finding more and more cysts and nodules over time. The second issue is the rise of incidence of thyroid cancer. And you see here that the total number of suspected cancers found in the preliminary baseline screening was 116. And of these, 101 cases of cancer were confirmed through operation. So we have a cumulative number of 101 cases at the end of 2014. The screening 2 years later, we found another 71 suspicious lesions, of which 54 were operated on because they were fast-growing, dangerous thyroid cancers, bringing the total to 155. In the third and fourth screening, you have additional cases, bringing the total at the end of 2020 to 198 official cases of thyroid cancer in the Fukushima children's population. Now, it's important to see that this baseline study was a large-scale screening in a healthy population. So there will always be a certain screening effect, and we don't really know how big it is. We don't know how many of these cases was already there before the nuclear catastrophe and were just detected because of the thorough screenings. For the other screenings, there can be no screening effect because all of these children were already pre-examined and found to be healthy. So the screening effect argument might be true for the baseline study, but it's certainly not true for the follow-up studies. In addition, there are 11 cases, as we've stated before, that were found outside of the Fukushima Medical University study because they were diagnosed at another hospital. at least 11 cases. And there are 4 cases from the age 25 milestone study, a study that I've said before has a very, very limited participation rate. So this brings the grand total, so to say, to 213 officially confirmed operated thyroid cases. Now, what is interesting is to compare this number to the amount of cancer cases that would be expected in this population. And we took a look at the National Japanese Cancer Registry and at the data 10 years before the nuclear catastrophe, from 2001 to 2011. And we found that the incidence of thyroid cancer in people under 25 years of age in Japan was 0.59 per 100,000 per year. So in a study population of around 218,000 people, we would expect about 1.3 cases per year, or over a course of 10 years, around 13 cases. On this graphic, you can see the number of confirmed cases of thyroid cancer increasing over time with every publication of Fukushima Medical University. And you can see the slow rise in the number of expected cases according to the Japanese Cancer Registry. And you can see that we now have 213 cases as opposed to the around 13 cases that would be expected. And what's more interesting even in this graphic is you can see that the rise in incidence does not just concern the first 4 years of the baseline study, where there certainly was some form of screening effect, but it extends to all the years since then. And we can see that the difference between the confirmed and expected cases increases year to year. So if you take a look at only the cases of cancer found in the first screening, the preliminary baseline study between 2011 and 2014, there were 101 cases confirmed, as opposed to the 7.4 that were to be expected. There's a factor of 14. Looking only at the cases of cancer found after the first screening, in 2014 to 2020, when there was no screening effect anymore, there were 112 cases confirmed and 5.5 cases expected. That's a factor of 20. So in very plain terms, ever since the end of the preliminary baseline study, we've had 20 times as many children contracting thyroid cancer in the study population Fukushima as was to be expected. And this, for us as physicians, for me as a pediatrician, is a very highly significant result of this study. The third finding is the development of precancerous lesions over time. And you can see here nodules and cysts of all shapes and sizes. And while not all nodules and cysts are obviously precancerous lesions, will obviously not develop into thyroid cancer, what is interesting is that the cases of thyroid cancer were frequently found in patients who previously had only cysts and nodules. The Fukushima Medical University's thyroid ultrasound examination divided the findings into 4 categories. A1 signifies a patient that has no nodules and no cysts in their thyroid. A2 is a patient who has nodules and cysts that are small. B is a patient who has nodules and cysts that are larger. And C is a patient that has very highly suspicious nodules or cysts with an acute suspicion of cancer. Now, this graphic takes a little bit of explanation. And what you see here is the cases of thyroid cancer found in screening 2, screening 3, and screening 4. And the percentage signifies the results in these patients in the previous screening. So of the patients that were diagnosed with thyroid cancer in screening 2, 46.5% had been A1 in screening 1, meaning they had no nodules and cysts whatsoever. But now in screening 2, they had thyroid cancer. 45% had small nodules or cysts in screening 1, and 7% had larger nodules and larger cysts. Whereas 1.4% were completely new because they did not participate in screening 1. In screening 3, we found that the vast majority, 46%, had small nodules and cysts in screening 2, whereas 23% had larger nodules and cysts, 20% had no nodules and cysts, and 10% did not participate in the previous screenings. And in screening 4, you can see that around 62.5% of the patients that were diagnosed with thyroid cancer previously had smaller nodules and cysts, 18.8% had larger nodules and cysts, and 18.8% had no nodules and cysts whatsoever. So you see over time a certain development that the number of patients without nodules and cysts is decreasing, whereas the number of patients with smaller or larger nodules and cysts is increasing. The fourth finding is one that I will touch upon very shortly because we have Professor Tsuda who will discuss this in greater depth later on. It's the regional difference in incidence. Very simply put, the Fukushima Medical University divided Fukushima Prefecture into 4 regions. The region with the highest amount of nuclear fallout, the 13 evacuated municipalities close to the power plant. Second, the middle section of Fukushima Prefecture that received slightly less nuclear fallout, which is Nakadori. Third, the northern and southern parts of Hamadori region, Iwaki in the south and Soma in the north, so the rest of Hamadori. And the fourth region with the least amount of nuclear fallout is Aizu in the west, protected by mountain ranges. And what the Fukushima Medical University found was that in the 30 municipalities, the incidence rate was well above 20 per 100,000. Whereas in Nakadori, which received less nuclear fallout, the incidence rate was around 14. In Hamadori, it was 10, and in Aizu, the region with the least amount of nuclear fallout, it was 7.5. The last finding that I want to discuss is the decrease of the age at exposure over time. Now, what does that mean? In the baseline study between 2011 and 2014, thyroid cancer was found in 101 patients. And if you looked at the age of these patients at the time of the nuclear catastrophe, it was between 6 and 18 years, with a mean age of 14.9. 2 years later, in the screening number 2, 2014 to 2016, the age at exposure of the patients that were found to have thyroid cancer was between 5 years and 18 years, with a mean age of 12.6. In the third screening, the mean age had decreased to 9.6, meaning there were people diagnosed with thyroid cancer that were 5 to 16 years of age at the time of the nuclear catastrophe. And in the latest, in the fourth screening, where we have results, we see that children who were just born in 2011 were now being diagnosed with thyroid cancer 9 to 10 years later. And the age bracket goes up to 12 years, and the mean age has decreased to 8 years. Now, this effect might be caused by excluding patients that are older, 16, 17, 18-year-olds, and all those that are wandering off into the age 25 milestone examination or not being examined at all. They are not included in this list anymore. They are not diagnosed. So obviously, the age at exposure is going down and further. But what is interesting is that we do see children who were just born in 2011 who are now 9 to 10 years later developing thyroid cancer. Now, at the beginning of my talk, I said that I will mostly focus on thyroid cancer just because there's the most amount of evidence because of the thyroid examination of Fukushima Medical University. Although it's not perfect, it's the only large study that we have. Concerning other cases of cancer like leukemia or solid cancer, breast cancer, prostate cancer, uterus cancer, there simply are no examinations being performed in Japan right now that would find statistically significant rises in incidence. What we do have are estimations by the International Atomic Energy Agency and WHO in their paper Health Risk Assessments, where they calculate an increased risk of contracting solid tumors of around 4%. For breast cancer, they calculate an increased risk of around 6%, and for leukemia of around 7%. Now, these numbers have been severely criticized, and we in IPPNW have issued a report where we say that for this health risk assessment, the source term estimates, the amount of radioactive material that was released was too low, The contamination of evacuees within the 20-kilometer zone were ignored by this study. The choice of food samples was very selective, meaning that vegetables with high amounts of contamination were not included in the study to calculate the risk of contracting disease from intake of radioactivity. All non-cancer diseases were ignored. People outside of Fukushima prefecture were not mentioned. And the increased vulnerability of the unborn child was not taken into account. So it was presumed that a fetus or even an embryo had the same vulnerability towards radiation as an infant or a larger child, which, as we all know, does not hold true. And there was a significant conflict of interest of the authors, many of whom were members of the International Atomic Energy Agency, an organization that, as we've talked about before, acts as a lobby organization for the nuclear industry and has as its aim the promotion of nuclear energy. So the risks are most likely significantly higher than those published by WHO and the International Atomic Energy Agency. How high they are, we will probably never know. And sadly, there are no epidemiological studies which will examine the rise in incidence in leukemia or solid cancers. So this brings me to my conclusions. We know now that there's relatively little serious and relevant research, except maybe on thyroid cancer. We know that the main focus on thyroid cancer comes because it has a short latency. Very briefly after nuclear catastrophe, the first cases of thyroid cancer can be found, whereas other solid cancers take 10 or 20 years to develop. Thyroid cancer has a very low baseline, meaning children usually don't develop thyroid cancer. It has a very low incidence, so any rise of thyroid cancer really sticks out. It's easy to detect, epidemiologically speaking, and the incidence rise is very significant. We have heard today that there are systematic attempts to invalidate the thyroid ultrasound examination screenings by Fukushima Medical University and the IAEA and the Japanese government, all of which have no interest whatsoever to show an increase in health risk for the people in Fukushima. We know that the TUE has major flaws, but it is still the largest study of thyroid cancer cases in children to date. We have seen a significant rise in incidence of thyroid cancer, which is not explainable by a screening effect. And we see a dose-effect relationship in the regional differences in incidence. And finally, we have to assume that there is most likely a very large number of unrecorded cases that are not included in the Fukushima Medical University's thyroid examinations, mainly because cases or participants are excluded from the study. There's a very high loss to follow-up rate, and so a vast number of thyroid cancer cases are never diagnosed, or if they are diagnosed, they're not included in the study reports. So our demands as IPPNW, as Physicians for Social Responsibility, is that there needs to be a respect for people's right to health and people's right to a healthy environment, UN universal human rights. There has to be a respect for people's right to be informed about health risks and their own health. Studies, neutral scientific studies, have to be financed and have to be enabled. Political and industrial interests must be completely banned from scientific research. And participation in scientific studies should be encouraged and not discouraged, not only for the benefit of the participants themselves, which might have an early diagnosis of a potentially fatal cancer, but also for the benefit of future generations. And let us not forget that although thyroid cancer is potentially treatable through operation, there are a number of people who, after such an operation, develop a new case of thyroid cancer, go into relapse, and require irradiation therapy or chemotherapy or additional operations because the thyroid cancer is growing, it's harming or threatening neighboring organs, veins, arteries, nerves, the vocal cords, These are all very real problems of the patients, children, adolescents who are diagnosed with thyroid cancer, who will for the rest of their lives have to go to doctor's appointments, need to have their blood taken, need to take thyroid hormones, have potential side effects from taking too little or too much thyroid hormone. So although thyroid cancer is potentially treatable, it is a very damning diagnosis for a child, an adolescent, a family to have, especially, and this must never be forgotten, if the family has the feeling, if the parents have the feeling that the child developed this disease for a reason they could potentially have prevented. This is, for the parents, the worst feeling in the world. And that is why we as physicians must work towards decreasing the number of children exposed to radiation, the number of children developing cancer and non-cancer diseases as much as possible. Thank you very much. Arigato gozaimashita.